The views and opinions expressed on Real Talk with Horace Sheffield are not those of WADL TV 38 or Adele Broadcasting Corporation.
Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk, real talk, real talk. Real issues straight from the heart, Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk, real talk, real talk.
Welcome to another edition of Real Talk. Of course, I'm Reverend Horace Sheffield. Hard to miss me or not know who I am. My co-host, Ms. DeAnna Solomon, a welcome addition. And some of you all tell me so often you're glad she's here. My show is much better now that she's a part of it. Welcome to the show, Ms. Solomon.
Thank you, Reverend Sheffield.
And we've been mentioning for a week or so that our shows are being brought to you by Midwest Health Plan. We're certainly pleased and proud to have them as our partner to make this show possible. And we want you to support them as they have supported us, and we'll tell you exactly how you can do that. Ms. Solomon, why don't you, oh, by the way, I didn't introduce my guest, Saul Faycurry, who is the Senior Manager of Medicare and Community Relations for Midwest Health Plan. Welcome to the show, Saul.
Thank you very much. Good
All right, Ms. Solomon, let's get right into this.
We're going to jump right in. We want our viewers to know who Midwest Health is and what you're about.
Midwest Health Plan was established in 1998. At that time, we were a Medicaid HMO.
Okay.
Since that time, we've evolved to handle the special needs plan, that being the Medicaid and Medicare combined membership, so to speak. We have 70,000 members on our Medicaid side. We're in St. Clair, Livingston, Macomb, in Washtenaw County, and of course, Wayne County.
Okay, and so you're located, your main office is headquartered here in Dearborn.
Yes, it is. We're on the corner of Michigan and Schaefer, formerly known as 550 Schaefer. Okay. We've got a new state-of-the-art facility that's on the other side of the corner on Schaefer and Michigan Avenue.
Okay,
Yeah.
I know the facility that we were at was spectacular, first class.
Absolutely.
And we want to let our viewers know right away that your information is going to be posted at the beginning and at the end of each of our segments. And there's a special toll-free number for our viewers. It's 888-495-4446.
One more time.
It's 888-495-4446. And we would welcome our viewers to call this number and actually leave your name and contact information so that a representative can reach back out to you and direct you accordingly within the Midwest Health Plan agency.
And the reason we want you to call, and this whole show's going to be dedicated to telling people what kind of coverages they need. I have a great passion for healthcare. My mom was a nurse. My dad was chairman of the board of Receiving Hospital, built a new hospital. And I know firsthand what it means not to have insurance, what it means not to be covered. And we want to make certain that if you're eligible for this coverage, that you make this call and you find out more about eligibility, because to not be covered puts you at risk of financial ruin, quite frankly. But let's talk about who's eligible and what the target population is that we need to really reach to make certain that they have coverage through Midwest Health Plan.
It's very simple. There's really actually two components to it. If you have Medicare A and B, and you have full Medicaid, meaning no spend down, in other words, there's the best description is a deductible. There is no deductible. You qualify for the special needs plan. With this plan, you get a lot of the coverage that normally doesn't come with Medicaid or with Medicare.
And it covers what? When you say special coverage, I mean more hospital visits, not out of pocket?
Actually, the benefits.
Okay.
You have comprehensive and preventive dental care, which is not covered under Medicare nor Medicaid. You have vision, where you can get glasses, frames of glasses once every 2 years. Transportation.
Sure.
To and from your physician or any type of medical or pharmacy for that matter.
Is there a certain age group we're talking about here, Saul?
Actually, there is, Reverend, the best way to describe it, there is really no age group.
Okay.
If you have Medicare A and B through disability and you have Medicaid, you qualify.
Okay.
If you are over 65 and you have Medicare A and B and Medicaid, Medicaid is based on your income. That is the driving force.
Okay. Now, one of the things that we've had conversations with you about that struck me is that there's a whole lot of folks out here who are eligible for this coverage, who either do not know it or feel that there's some shame or stigma with having Medicaid or Medicare or one of the two. And can you really speak to that? Because it seems to me that if you don't have insurance, you're eligible for this. You've actually, if you worked in your life, by the way, you've paid money into this. This is something you're entitled to. You've helped pay for. Why would people feel reluctant to take advantage of it?
Well, number one, this specific program, the special needs program, is just since 2006. It was all part of the Modernization Act of the passed under the Bush administration. Number one, a lot of people don't know about it.
Okay.
But number two, and more importantly, our economy has put a lot of people in situations now between losing their jobs, losing their pension that was tied in with the stock market. You're entitled to this. This is what government is about. And it gives you the opportunity to get the care that you need. The last thing somebody needs is to go into an emergency room and get a bill for anywhere from $5,000, $10,000, $20,000.
Right. Well, we're going to take a break. This is being brought to you by Midwest Health Plan. Get a pad, get a pen. I'm going to give you some information so that you can get covered. This is new. A lot of folk don't know about it, and that should not be you. We'll be right back after this.
Real talk, real talk, real talk. Take a walk down this path through Detroit. This is Real Talk.
Real Talk is sponsored by Midwest Health Plan.
Real talk, real talk, real talk. Take a walk down this path through Detroit. This is Real.
Welcome back. I'm Reverend Horace Sheffield again, of course, being brought to you by Midwest Health Plan. This is Real Talk on WADL, and Ms. Solomon is my co-host, talking to Sal Faycurry from Midwest Health Plan and trying to get into, I want to just pick that up again, and we'll go to Ms. Solomon about why is it that people aren't aware of this. You said some of it's because it's new.
Yes.
Some of it because they may not know that they're eligible for it.
Very much so. Number one, it's all based on the federal poverty level. And the federal poverty level right now sits at about 38% of the federal poverty level for anybody to qualify for this. In round numbers, when you start throwing percentages out there, people don't understand. Example, if you earn $5,000 or less, you qualify. Mm-hmm. You are eligible for it. All of this came about, and there's going to be some major changes. People that did not qualify before may qualify now, will definitely qualify in 2014 when they enact the full Obama plan, the health care plan.
I want to take a break again and tell you there's a number that's going to be on the screen for Midwest Health plan. That is specifically a number that's been assigned to Reverend Sheffield. I decided to help these people, get people who are not covered into this plan. I'm sharing with some of my family members who don't have medical insurance and may not even know that they're eligible. At least call to find out. Doesn't cost you anything to get the information. You ought to be making that phone call right now as we speak to find out whether or not this means you, Ms. Solomon.
Yes. Well, the number to call again is 888-495-4446. And speaking of when we were getting ready to take our break, I mentioned to Sal, I said, you know, there's no cost, correct, to joining the Midwest Health Plan coverage.
Correct. There is no cost whatsoever. It's covered through your Medicaid and your Medicare. Incidentally, the one thing that people need to realize too, you're not giving up your Medicare or your Medicaid.
Okay.
This is a substitute for a period of time. Mm-hmm. You renew on a yearly basis. Mm-hmm. And also in retrospect, you must maintain your Medicaid or you lose this coverage. This is a specific plan that's designed.
Supplemental.
Not supplemental.
Okay.
We take over all of your health care needs.
Okay. But now with managed care and the new bill that's been passed, isn't there some advantage to getting on board now? Because after a while, people are going to be assigned and basically escorted or driven to different plans without any real choice of their own.
True. I mean, basically what's happening now, number one, in 2014, when they fully implement the Obama plan, the federal poverty level goes from that 38% that we talked about to 138 to 142%. So now all of a sudden people that weren't qualified now are qualified. And we're expecting in the state of Michigan alone anywhere from 250 to 650,000 newly eligible. And you're right, Reverend, they are going to start auto-assigning. Government is starting to recognize, let the professionals administer and deliver the health care. Government can't do it, or they have additional
Well, one more
costs.
question before I go with Ms. Solomon, because I'm getting old and I will forget. If they don't have this insurance through Midwest Health Plan that you offer, and they go to the doctor, I mean, basically, are they paying for these services out of their pockets?
They could, if they have, let's put it this way, the best way to describe this, Medicare covers 80%.
Okay.
20% comes from somewhere, usually the person's pocket or what they call supplemental insurance. Now, if they have the Medicare A and B and they have full Medicaid, they're not going to have to come out of their pocket, but they're not going to get all the benefits that by enrolling in a health plan they would get.
So if you're in that situation, and I'm going to Ms. Solomon, if you're in that situation, even if you've got the Medicaid and Medicare A and B and all that, you still need to be with Midwest Health to get these additional benefits. Is that
Yes,
correct? Okay.
that is correct.
All right.
Based on the upcoming changes then that will occur in 2014 in healthcare, are there any future programs that you have in place now that you're going to roll into those into 2014 with the actual changes, or are you just preparing?
We are preparing right now. We've already, we're putting together plans to deal with long-term care situations. We are putting plans together for what we spoke before, spend downs, people that are on the spend down, to provide them with coverage.
Explain spin down. You've said that a few times, and
Yeah.
you know, spin down could be some older guy's got a young girlfriend, you know, and
Yeah.
trying to spin down his principal. I don't know. I mean, what is spin down?
Basically, what a spend down works is people have Medicare A and B and they have Medicaid. But their portion of the Medicaid, the state is saying to them, well, you have to have the first $500, the first $200 out of your pocket.
Okay. So in other words, they've got to spend a certain amount before it kicks in.
Absolutely.
All righty. Thanks for helping
Absolutely.
me understand that. Ms. Solomon?
Yeah. So, what does your ideal client look like now? What does that the person that you serve deliver services to the most?
What is really amazing is that the special needs plan, and a lot of people would think that it's a senior citizen that is our main person, but in reality, there are far more people on disability that have A and B and have full Medicaid than there are retirees. But it also applies for the retiree over 65. Through whatever reason they're at that federal poverty level. They qualify for this. They've worked all their lives. Take advantage of it. It's not your fault the stock market went south.
Dive, right, and took your money with it. And the thing about it is they probably, while they were working, were paying money into some of these sources of assistance that are now available to them.
Oh, absolutely.
And so
Absolutely.
you really are not getting something that someone else created or paid for. You're getting something back on monies and taxes you already paid.
It's that safety net
Right,
that they've talked about dating back to Roosevelt's days.
right.
You know, it's a shame, and nobody should have to decide whether to get a prescription filled or get groceries,
Right.
to get medical care, or whatever other needs they need to have.
Right.
They should not have to make those choices.
Right. I want to remind you again, of course, this is being brought to you by Midwest Health Plan. The number will be on the screen. Our goal here, the reason we invested in this, because we're concerned about those thousands of people out there who are not covered sufficiently. There's no way to avert, bill collectors or people going after you. I mean, hospitals are in business. If you get services, they want their money. And if 80% of it's covered, 20% of it's not, they're looking for you to pay that. But we want to make certain that every conceivable coverage that you're entitled to, if you're disabled or you're at that level economically that you're entitled to this, that you call and find out whether or not it is you that can take advantage of this. obligated, you know, you're simply trying to find out some information so that you can find out what is best for you. What's that phone number again, Ms. Solomon?
The number is 888-495-4446.
One more time.
So it's 888-495-4446. And that's a number where our viewers can actually call in to provide their information, and then a Midwest Health Plan representative would actually reach back out to you and direct you according to your need.
All right. This is being brought to you by Midwest Health Plan. We're going to take a break. When we come back, we'll have some more questions about how you can access what you need.
Real talk, real talk, real talk. Take a walk down this path through Detroit. Detroit, this is real talk.
Real Talk is sponsored by Midwest Health Plan.
Real talk, real talk, real talk. Take a walk down this path through Detroit. Detroit, this is real talk.
Welcome back to Real Talk. I'm Reverend Horace Sheffield III, and I'm pleased and proud that you're watching our show, and we thank you for your support. Of course, Ms. DeAnna Solomon, who's been a welcome addition to our program. This is being brought to you by Midwest Health Plan. I'm gonna just try to help ferret, you know, some fact from fiction. During our break, you know, some of the folks in the audience had a couple questions. Just make it real clear for us all, Sal rather, who's eligible and what are the benefits that they get?
The people that are eligible, you must have Medicare A and B and full Medicaid. Now, one of the
So
questions.
let's back up though.
Sure.
What if they're eligible for that and they don't have it? There's some folks out there that have nothing, and they may be eligible for that. Do
Actually,
they have to have that first to call you? Or can they call you and you get that for them and then they get the rest?
well, I can direct them the phone number to call.
All right, well, good. I mean,
You
there's some
know,
people out there may be eligible for Medicaid or Medicare, don't have either one.
Well, things have changed a lot. The Medicare A and B, number one, is normally, unless you're disabled,
Right.
normally when you retire, it was automatic.
Okay.
It would be sent out
Kicks
to you.
right in, okay.
However, now with all the budget cuts and everything else, you got to pick up the phone. You got to be proactive. You've got to call and say, "Hey, where's my Medicare card?
And,
I
and
need
when you
it."
retire at 62, 65, is there an age for that? Sal?
65.
At 65 years of age, now see, this is what I'm talking about. Now we're really helping people. You retire, you don't get it in the mail anymore. The government's not saying, hey, this is yours, come get it. You got to say, hey, this is mine, where's it at?
Exactly.
You got to make a phone call.
Exactly, the Social Security office. As far as the Medicaid portion of it, again, you've got to call Department of Social Services, and they'll ask you some questions, and they're going to say, well, you don't qualify. Tell them, just send me the form.
Right,
You know, they're making a judgment with a 2-minute conversation.
right.
Send me the
They
form.
made a judgment when the phone rang.
For the most part. So send me the form. Let me fill it out.
Right.
And you got to be proactive. A lot of people, and we talked about spend down before, a lot of people may not need to be on spend down anymore. But when you have a caseworker that has 3,000 files on her desk or his desk, they're not going to call you and say, hey, guess what? You don't have a spend down anymore. You qualify. All of this, you must be proactive.
Yes.
You have to call.
Sure. And that's why we're partnering with Midwest Health Plan, because I know Dr. Saffer and all the folks who've been a part of this, and I know you guys are interested in making certain that people get what they rightly deserve and they have the information to make the right decisions. That's why we want you to call that phone number. Ms. Solomon, what's the number again?
The number again is 888-495-4446.
One more time.
888-495-4446.
And we're going to partner with WADL on my show to have some kind of senior or some kind of community forum where people can come out and get some information and find out for themselves. Because I know for a fact that unpaid medical bills affect your credit. You know, they call you, you're already sick, and they're calling you, you know, we're going to come get this. You know, I mean, come get it, you know. But the reality is we want to help people. Ms. Solomon?
Yeah. You know what? Getting a better understanding of your program, this is an HMO, correct?
Correct.
So as a member, I would need to choose and select an actual primary care physician.
Correct.
Do you have a list for members to choose from? Or would I go to my primary care physician that I already have a relationship with, and would I say, you know what, are you a member of Midwest Health Plan, or can you become a member of Midwest so that I can use you as a primary care physician?
In reality, either or.
Either or.
He
Okay.
could be a physician that's already within our network, or we would invite him to join our network. And here's one important thing too. HMO stands for Health Maintenance Organization. We want to see you get your immunizations. We want to see you for your checkups. And it's no big secret. If we keep you healthy, it's be cheaper for us down the road.
Sure.
That's the reality of it. And one more important thing. Within our network, if you have to see a specialist, as long as he's in the network, you don't need a referral. Go see him.
Wow.
That's wonderful.
Okay.
Give out the number one more time. I really want you, Pastor Sheffield, not just a TV show host, is encouraging you to get information. I could not believe, Sal, the number of folks out here who are eligible for this who are not taking advantage of it. It's been around since 2008, you said?
2006 is when it was
2006, and
implemented.
there's still a lot of folk out there who are eligible, who may be paying for things out your pocket. They could go for food on your table. I mean, you need to find out if you are eligible. And what is that phone number?
The number again, Reverend Sheffield, is 888-495-4446. And this number is specifically for our viewers to call, provide their information, just a name and contact, and then Midwest Health Plan will reach back out to you and discern your need and direct you accordingly within their network.
When you say specifically for our listeners, and viewers, I want to make sure we say it again. We've arranged something with Midwest Health to make certain that those people who watch Real Talk can call this number, and it is only for my viewers to make certain that you have a pipeline to get the information you need. You're not put on some super highway of millions and thousands of folks calling. They're committed to making certain that whoever Reverend Sheffield has calls. I'm not getting paid anything on making sure you know that. What I get out of this is making certain that you're not being gouged, you're not spending money for something you don't have to, and that you have the full range of coverage to make certain that there's no reason for you to protect your health and to maintain your health.
Yeah, this is all about education and actually commitment to caring for the people of Detroit and the surrounding area. So we know that the mission at Midwest is also about caring and protecting the people that you serve. So,
Absolutely.
Sal, what other programs do you find most people, once they enter into the program, are surprised to see?
We have a health manager who is a registered nurse that they can call in, and if they have any questions about care or they need something, she will assess their situation and direct them to the proper areas. Whether it be hypertension, diabetes, things of these nature, they're constantly going to have a number that they can contact and get the care that they need, or at least the information they need.
Yeah, that's
Yeah, go ahead.
That's a wonderful
Sure.
benefit. I had something very similar to that years ago, about 15 years ago, through my employer, and it's a weight off when you know that you can reach out and make a phone call just to ask a question and not actually schedule an appointment to go see a doctor and go through all of those other steps. So that's a wonderful program.
So before we go, why don't you just take a moment? I've done my best to encourage people to make that phone call, to get the information, to be empowered, to take that first step. What would you tell them if they're reluctant?
There's no obligation. At the very least, education is power. The more information you have, the better informed decisions you can make. Midwest may not be the plan for you, but at least we're going to guide you to where you need to go. And again, there's no obligation.
What's the phone number as we close down, right?
Yep. The phone number again is 888-495-4446.
This has been brought to you by Midwest Health Plan. I'm Reverend Sheffield. We'll see you back here next week.
Real talk. Real issues straight from the heart. I'm giving you real talk. Take a walk down this path through Detroit. This is real talk. Real issues straight from the heart. I'm giving you real talk. Come take a walk down this path through Detroit. This is real talk. This is real talk. Uncut for the people of Detroit who got an opinion that they want to voice. I'ma give them real talk. Real issues, real topics, real people addressing real matters. No gossip talk for the people that can. Since day one we been here. We ain't leaving. Detroit still breathe. Real talk. I love the city, so I speak from the heart. From my experience, I give them real talk. This is real talk here. So I gotta talk real, conversate about topics Detroit